Welcome, everyone, to Senior Health Tip, a podcast where we talk about real health problems that seniors face every day in simple and clear language. I'm David, your health expert for today's episode.
Wonderful to have you, David.
The pleasure is mine, Nadia.
And I'm Nadia, a senior myself. I'm here to ask the questions that you, our listeners, are probably thinking too. David, please keep it simple today. No big medical words.
Of course, Nadia. Simple it is.
You have my word, Nadia. Today, we're talking about one of the most important health topics for seniors, diabetes. We'll cover what it is, why seniors are more at risk, the warning signs, how to eat better, how to stay active, and we'll answer the most common questions seniors ask about diabetes. So, let's get started.
I'm ready. And honestly, I've been a little nervous about this topic because so many of my friends have diabetes and I feel like I don't fully understand it yet.
That's exactly why we're here. Let's clear up the confusion together.
David, start from the very beginning. What exactly is diabetes? Explain it like I know nothing about it.
Perfect starting point. Diabetes is a chronic condition that affects how your body processes blood sugar, which we call glucose. When you eat, your body breaks food down into glucose. To move that glucose into your cells for energy, your body needs a hormone called insulin. In diabetes, this system breaks down. Either your body doesn't produce enough insulin, or it can't use insulin effectively. So the glucose stays in your bloodstream instead of going into cells. Over time, this causes serious damage to the heart, kidneys, eyes, and nerves.
And is this a big problem around the world? How many people have it?
It's massive, Nadia. According to the World Health Organization, in 2022, about 14% of all adults worldwide were living with diabetes. That's double the figure from 1990, which was 7%. And in the United States alone, the CDC reported in 2024 that approximately 40 million people have diagnosed or undiagnosed diabetes, which is around 12% of the entire U.S. population.
That's shocking. And what about seniors specifically?
Seniors are the highest risk group. Research published by the American Diabetes Association shows that about half of older adults, people 65 years and above, have prediabetes. And the CDC's 2024 statistics report that 31.3 million people aged 65 or older in the U.S. have prediabetes. That means their blood sugar is already elevated even if they haven't been diagnosed with full diabetes yet.
Okay, David, so why exactly does aging increase the risk? Is it just because we get lazy?
Not lazy, just biology, Nadia. Several age-related changes increase the risk. First, the pancreas, the organ that makes insulin, gradually becomes less efficient as we age. Second, older adults often experience what's called insulin resistance, meaning the body's cells don't respond to insulin the way they should. Third, muscle mass naturally decreases with aging, and muscles are major consumers of blood sugar. Less muscle means less sugar being absorbed from the blood.
I didn't know muscle loss was connected to blood sugar.
It absolutely is. The ADA's 2025 Standards of Care for Older Adults specifically notes that diabetes in the aging population is linked to reduced muscle strength and accelerated loss of muscle mass. This creates a cycle where less muscle leads to worse blood sugar control, which leads to further muscle loss.
What other factors make seniors more vulnerable?
Reduced physical activity is a big one, which the WHO confirms is a key risk factor for type 2 diabetes. Weight gain around the abdomen, poor sleep quality, chronic stress, and taking multiple medications, which is very common in seniors, can all raise blood sugar levels. And of course, genetics plays a role. If a parent or sibling had type 2 diabetes, your risk is significantly higher.
David, this is the part that worries me most. How do seniors know if they have diabetes? Because I've heard many people have it for years and don't know.
You're completely right, Nadia. Type 2 diabetes is often called a silent disease because symptoms can be very mild or even absent in the early stages. This is especially true in seniors. But here are the key warning signs to watch for. Feeling very thirsty all the time, frequent urination, especially at night, feeling persistently tired or fatigued, blurry vision, slow healing of cuts or wounds, tingling or numbness in hands and feet, and getting infections frequently.
The problem is, I thought some of those were just normal signs of getting older, like being tired or going to the bathroom at night.
That's the danger, Nadia, and you're not alone in thinking that. Many seniors dismiss these early symptoms as just aging, but these can be real warning signs. This is exactly why the ADA recommends that all adults over age 45 should be screened for diabetes every 1 to 3 years, and more frequently if you have risk factors.
What kind of test are we talking about?
The most common is a fasting blood glucose test. You don't eat for 8 hours, then a blood sample is taken. A result below 100 milligrams per deciliter is normal. Between 100 and 125 is prediabetes. 126 or above is diabetes. There's also the HbA1c test, which shows your average blood sugar over 3 months, very useful for ongoing monitoring.
And how often should seniors who already have diabetes test their blood sugar at home?
That depends on your treatment plan and your doctor's advice, but the ADA now recommends that older adults with type 1 diabetes especially can benefit greatly from continuous glucose monitoring, CGM, which tracks blood sugar in real time throughout the day and night. It's been shown to significantly reduce dangerous low blood sugar episodes in seniors.
David, now the section everyone is waiting for, food. What should seniors with diabetes or those wanting to prevent it actually eat?
This is so important. The American Diabetes Association is very clear that there is no single magic diet for diabetes because everybody responds differently to food. But the key principle is control carbohydrates, prioritize fiber, include lean protein, and choose healthy fats. The CDC recommends that people with diabetes aim to get about half their total daily calories from carbohydrates, but the quality of those carbs matters enormously.
What's the difference between good carbs and bad carbs?
Complex carbohydrates like oats, brown rice, whole wheat, and legumes are digested slowly and cause a gradual, gentle rise in blood sugar. Simple carbohydrates like white bread, white rice, refined sugar, candy, and pastries are digested rapidly and cause sharp blood sugar spikes. For seniors with diabetes, complex carbs are far preferable. Vegetables, especially leafy greens like spinach, are excellent because they're high in fiber and very low in sugar.
What about fricks? I love mangoes and bananas. Am I allowed to have those?
The mango question. This comes up so often. Fruits are healthy and contain important vitamins, but some fruits are high in natural sugars. The advice from registered dietitians working within ADA guidelines is to consume higher sugar fruits like mangoes, bananas, grapes, and lychees in small portions, and not every single day. Lower sugar fruits like guava, papaya, berries, and small portions of apple are better daily choices.
And tea? Many seniors in our community drink very sweet chai multiple times a day.
This is a significant source of hidden sugar. Each cup of chai with 2 teaspoons of sugar taken 3 or 4 times daily adds up to a very large amount of added sugar. Reducing the sugar in tea is one of the simplest changes seniors can make. Even cutting it in half makes a meaningful difference over time. The WHO recommends reducing free sugar intake to less than 10% of total daily energy intake, and ideally below 5% for additional health benefits.
David, I know exercise is important, but what about seniors who have knee pain, joint problems, or get tired quickly? What's actually realistic for us?
This is such a practical concern. The great news is that even light exercise makes a real difference. The CDC recommends that people with diabetes start with something as simple as a 10-minute walk after dinner and gradually build up. The goal is 30 minutes of moderate activity on most days. Walking is excellent because it helps muscles absorb glucose from the blood naturally, which lowers blood sugar without any medication.
What if someone truly can't walk much due to joint problems?
There are excellent low-impact alternatives. The ADA's 2025 standards of care specifically state that lifestyle management for older adults must be tailored to their frailty status. Chair-based exercises, gentle yoga, water aerobics or swimming, and even stretching and light resistance exercises using small weights all help maintain muscle mass and improve blood sugar control. The key message is, some movement is always better than no movement.
What about sleep? Does that actually affect blood sugar?
Absolutely, and this is something many people don't know. Poor sleep causes the body to release stress hormones like cortisol, which raise blood sugar levels. Multiple studies have confirmed this connection. The NHS and CDC both emphasize that 7 to 8 hours of quality sleep per night is important for blood sugar management in seniors. Stress management is equally important. Chronic stress has a direct impact on blood sugar levels.
Okay, David, now let's do our FAQ round. These are real questions from our listeners. Ready?
Let's go.
Can type 2 diabetes in seniors be fully reversed or cured?
Type 2 diabetes can go into remission, meaning blood sugar returns to normal levels without medication, through significant lifestyle changes, including diet, exercise, and weight loss. However, the ADA does not use the word cured because the condition can return. The earlier you act, especially during the prediabetes stage, the better your chances of reversal. Many seniors who make serious lifestyle changes see remarkable improvements.
If I'm taking diabetes medication, do I still need to diet and exercise?
Yes, absolutely yes. Medication is a tool that helps manage blood sugar, but it is not a replacement for a healthy lifestyle. The ADA and CDC are both clear that for older adults with type 2 diabetes, an intensive lifestyle intervention focused on dietary changes, physical activity, and modest weight loss of even 5 to 7% is recommended for its benefits on quality of life, mobility, and heart health. And this is in addition to medication, not instead of it.
If my parents had diabetes, will I definitely get it too?
Family history does increase your risk. This is well established. However, it is not destiny. The WHO confirms that a healthy diet, regular physical activity, maintaining normal body weight, and avoiding tobacco use are proven ways to prevent or delay the onset of type 2 diabetes, even in people with strong family history. So genetics loads the gun, but lifestyle pulls the trigger. Or doesn't.
My doctor said I have prediabetes. Is that serious, or should I not worry yet?
Prediabetes is absolutely serious, but it's also your golden opportunity. The ADA defines prediabetes as a fasting blood glucose of 100 to 125 milligrams per deciliter, or an HbA1c of 5.7 to 6.4%. Prediabetes means your blood sugar is elevated but hasn't reached diabetes levels yet. With the right lifestyle changes now, particularly diet and exercise, many people with prediabetes never progress to type 2 diabetes. Don't ignore it. Act on it immediately.
Are there any natural remedies that help with diabetes?
Some natural substances show supportive benefits in research. Fenugreek seeds, bitter gourd, cinnamon, and amla have all shown modest blood sugar lowering properties in studies. However, I want to be very clear, these are complementary, meaning they support your treatment plan. They do not replace medication or medical supervision. Always tell your doctor if you are using natural remedies, because some can interact with diabetes medications.
David, I genuinely feel so much more informed now. Thank you for explaining everything so clearly and backing it all up with real, trusted sources. That's exactly what our listeners deserve.
Thank you, Nadia, and thank you to all our listeners for trusting us with your health. Here is the most important thing I want you to take away today. Diabetes is manageable. The WHO, CDC, and ADA are all united on this. With the right diet, regular physical activity, consistent medical checkups, and good sleep, seniors can live long, full, and healthy lives even with diabetes. Please don't let fear stop you from getting tested or seeking help. Knowledge is your most powerful medicine.
Beautifully said. If this episode helped you, please share it with a senior you love, a parent, a grandparent, a neighbor. Health information is the best gift you can give. And if you have a health question you'd like us to cover in our next episode, leave it in the comments. We read every single one.
Until next time, stay informed, stay active, and take good care of yourself. This is David.
And this is Nadia, signing off from Senior Health Tips. Take care, everyone.